any question about that before I share these? And in fact, Sherry or Jen, if you can give me access to be able to upload a document, I can do a screen share, but I feel like it might be helpful for people to be able to look at it on their own, as long as you promise not to share them beyond that, knowing they're like going to change tomorrow based on your input. So I have that it says access to file restricted by your account admin. So I don't know if that's changeable.
Jen, do you know?
Can
Maybe
you add it in the chat, Beth?
That's what I'm trying to do. In security settings, you might be able to open the, or even in the chat function. It's okay. So questions about the process before we dive into the actual recommendations, because then we're going to get pretty detailed. So I want to make sure that folks understand kind of the level at which we're trying to write recommendations, what we are bringing forward at this time. Ideally, we are also looking for recommendation. I mean, the State Advisory Council is a public-private partnership, and so we are looking to build ideally consensus from the State Advisory Council members to be able to adopt these. There have been times where some folks have had to stand aside, but that is not the ideal. The ideal is we find stuff that that SAC can endorse. No questions.
Beth, it shows that we've permitted everything. Isn't that what you're saying, Jen? Like everything that we can check is checked.
Okay. All right. Well, then I will just do a screen share and then maybe email this separately.
If you want to email it quickly to me, Beth, I can put it in the chat.
Okay. Thank you.
At Let's Grow Kids.
Thank you, Jen, with the many email addresses.
She's everywhere.
Okay. All right, coming your way, Jen. So we are building policy recommendations kind of across a whole range of issues related to basic needs, paid family leave, data systems, family leadership. And what I've done, and I'm going to share this document, is isolate the ones that pertain particularly to this group. Not that you're not interested in the others, but they are still a moving target. So I feel like it's best for our time to use to look at just the ones related to goal 3. So this is the kind of thing where if you're multitasking, it's going to be hard to follow along because we are looking at something a little bit more detailed. So if we can borrow your time to look at these policy recommendations. So high quality and inclusive physical and mental health services. This relates to goal 3, as I said. I'm going to see if you can see that, make it a little bit bigger. How's that? Better? Okay. Yeah, I know. I need glasses, but I don't wear them. Mental health. So invest in strategies and workforce needs that are necessary to support children currently in high levels of crisis care or out of state. Expand rate increases for mental health services provided to DAs and SSAs, to all mental health service providers that receive Medicaid. Ensure rate increases for mental health services keep pace with the true rate of inflation for providing those services. And then elevate the promise of mental health integration strategies as described by the Mental Health Integration Council. So this is not something that, well, we have talked about mental health. We have talked about suspension, expulsion, and the acute needs of children and families. We have not talked about children in residential programs, but this certainly comes up at some other tables. So I'm just going to give you a tour first, so you see what else is down here, and then we'll come back to the details for discussion. Okay. Mental health. Then we move on to kind of inclusive early care education after school programs. This first one is renewed from 2022. Seize the day on UPK, expand access to UPK toward a vision of universal, high quality, equitable, mixed delivery, free and inclusive education for all 3 and 4-year-olds. I'm sure we can all imagine why that is coming back up right now, based on what was passed in Act 76. So I'm not going to get into the details there, but that's there. The next one is around Act 76 implementation, which was feedback from this group. Prioritize the successful implementation of Act 76 to meet the law's goals to expand access and quality of childcare, stabilize the early childhood education system, advance the early education workforce, maintain a mixed delivery system for pre-K, childcare, and after school and summer care, among other goals. Talking about ensuring implementation plans include sufficient opportunities for stakeholder engagement, is the sub-bullet, and ensure outreach and communications to families and the field prioritize the different needs of all impacted communities. So that's about implementation. And then this third one here I've highlighted is screening and services for children with autism. Again, a placeholder based on our discussion last month around improving access to developmental screening and access assessment, and develop flexible strategies to deliver family-centered care throughout a child's journey from early identification and diagnosis through adult services. We can build that one out, but that was kind of some of the concepts that came up last month. There's a placeholder around workforce. This is a place where we might spend some time discussing that. It might also come up for discussion at Professional Preparation and Development Committee, which meets next week. And then a seamless, equitable data-driven system of services. I left this here because I feel like we talk about data systems and I wanted you to know that this is in here. So responding to inequities in data collection and reporting in order to better represent and understand intersectional experiences of people of color, children with disabilities, and other marginalized communities. And then calling for critical investments in data infrastructure to support case management and service delivery. So not as much about the conversation at this group, but I know that some of you care about these pieces. So I'm going to pause as I've given you not all of the policy recs that we are considering, but the ones that I felt like most related to this group. And would love a proposal if there's one that you'd like to start discussion on to provide some feedback about, again, what's the call to legislators, to policymakers, to the administration? What do you feel like is actionable in the next year? So that's the frame. And Cynthia, let's start there.
Thanks, Beth. I actually just have a context question maybe for you, since you're kind of seeing the recommendations across all work groups. I'm just curious, do you have a sense of those that are sort of whole population, maybe prevention in scope versus targeted population, intensive needs? I'm just curious.
Yeah.
I guess for myself, like how are we as a system, as an advisory group, sort of balancing for our legislature? We really need to take care of these high needs pieces, and we also want to look at prevention. Right. So I'm trying to get that idea.
We're doing both, right? There are, and that's something that we've navigated and we've tried to navigate over the last couple of years is sometimes there are pretty specific needs or groups that there's gaps, and that we can, that in some ways that might be just as effective as some of the kind of much larger calls to for policy change. So there's both, right? What I haven't shared the goal 1 draft recommendations, but around paid family leave, we're considering something around housing, perhaps something around kind of food security. There's also been kind of an emerging issue around perinatal supports, and supports particularly for families who have lost a child and all of a sudden don't have access to services like CIS because the child has passed. So yes, there is a balance between that prevention kind of whole population, but we're doing both.
Thanks. And my comment wasn't a judgment. I was just curious what we're doing. So this is helpful. Thank you.
It's something we've discussed long and hard as well. Other questions or observations?
I would say, oh, sorry.
Go ahead,
Oh,
Amy.
sorry. Claire has her hand up. I'll wait.
Yeah, I mean, it's out of order, but it resonated at the very end when you had the data piece there, Beth.
Yeah, let me bring it up.
Yeah, I think you had like a child welfare MIS.
Yep.
Yeah, and so I'm just gonna beat the drum again for making sure CIS is highlighted here in this, because talk about working with the vulnerable population, and whatever the language is, I can't see it exactly, but around disability, supporting folks marginalized, etc. But anyways, CIS and naming it specifically, in addition to the comprehensive child welfare information system, I would make a recommendation that we call it CIS specifically. Thanks.
Okay. I'm just making notes in here for my own benefit. And we have a recording, and Jen's helping to take notes. All right, Amy, would love to hear from you.
Sorry. And I didn't mean to jump ahead, Claire. Sorry. I was just kind of looking at the document itself and not looking at
go for it. Tell me where you want me to navigate. And
so I guess it would be just to this middle one. Well, sorry, above the early, yep. Right here for equitable access. I was looking to see if there was anything about, and I mean, this is going to be close to the work that I do, but anything related to multi-tiered systems of support, because it is something that is part of the PDG, and we're scaling this up. We're trying to scale this up across Vermont. It's a systematic approach. It's got measurement tools. It's got evidence-based practices. So it's extremely equitable, and it's a tool that it promotes high quality. I mean, within that system, one of the critical components is high quality, kind of universal environments, learning environments. So I wonder if there's room in here to include something about that. I feel like it was in last year's.
Yeah, we have had early MTSS in there in the past. I think the placeholder here is coordinated, calling for some kind of coordinated or recognition of kind of the diverse approaches to professional development that promote inclusion and reduce exclusionary discipline. This language is rough. But I think we need to think about, are we calling for early MTSS, which not everyone has access to, or are we calling for increased professional development and support for early educators to be able to navigate those difficult behavior, the challenging behaviors and respond to the needs of children and families. So let's think about what the call might be, right? Given there is funding currently, like what's the ask, and to what end?
I would just say the biggest challenge, because that PD is a component of early MTSS, I would say the biggest challenge is, so if we promote professional development in a variety of ways, their systems still aren't set up to support high quality in an equitable manner, because there's other areas that aren't being included. That's all. I just want to kind of include that bit as we process and think about it. Thanks.
Thank you. Yeah, Cynthia.
And I was just wondering, so many of these for me are interrelated. I'm sure they are for others as well. So I was wondering about early MTSS and those kind of professional development supports, also thinking about those as sort of prevention for the mental health. And of course, folks may disagree and want to keep mental health very separate as its own piece, but I do wonder, is there a way for us systemically to tie some of these together so it doesn't feel like quite so many distinct categories for legislators and policymakers that somehow we recognize that there's, again, sort of this balance of intervention and prevention. And so I was thinking about early MTSS within those mental health pieces as well, if it resonates.
Yep.
And sorry, just as a quick follow-up, I jumped into the mental health report, and there is something on the recommendation of integration of workforce development. And so I just wonder, again, that might be very specific for mental health workers specifically, but I do wonder if that work group would be interested and open to thinking about PD sort of integration more broadly.
Yeah, thank you. Sherry?
Yes, can you scroll back down to the little further? What we were talking about exclusionary discipline.
Yeah,
So
right
yes. So I understand this is a draft sentence, but I actually appreciate that it isn't that it is looking more broadly at what kind of professional development and could be needed or systems in place. And what I would really like to hear, and maybe I see Claire's hand up, maybe this isn't what she was going to talk about, but maybe she could comment on that. And I know Linda January's on, and Lori Metcalf and Chris, all people who work, in the field with kids who are really trying to, include all children, serve all children, all of those pieces. And just would love some feedback from some of them around this specific goal and placeholder.
Yeah, I was just pulling up, Sherry, the PIES report. I mean, there's so many acronyms, right? And it was driving me crazy to remember what was this called, but anyways. If folks can remember that or have seen it, it's the UVM report that looks directly. Do you guys know what I'm talking about? The PIES report, the legislature was given to them, and it's all about what we're talking about, and there are recommendations around professional development for the ECE workforce, UVM, educational and social services, as well as UVM's Center on Disability and Inclusion, and it's March 30th, 21. So it's promoting inclusion and exploring support for children with specialized needs in early childhood settings, recommendations for preventing suspension and expulsion. Sound familiar to anybody? Yes, right. So it will be really good. My point is, rather than me trying to get in, yeah, okay, perfect. Let's capture that and have that be a reference point for as this is being built out, because there's a ton of high level university level data. And there's recommendations in there, and it gets into more of the detail around professional development and early childhood and family mental health. So Beth, if you want, I can forward that to you.
Yeah, I appreciate you reminding us of that report. I definitely have it.
It's because we do that all the time, right?
Right.
We have we have work groups that come out of the legislature and there's reports that are issued, and then 2 years down the road, it's like, oh, we're reinventing the wheel again. So I don't know. I was just like trying to say, what do we already know? So I'll forward that. Thanks.
Yeah. So for those of you who might not remember with the PIES report, it was essentially a pilot project funded under the preschool development grant planning grant that Lori Myers oversaw out of UVM. And it was an implementation of both early MTSS and strengthening families, and the evaluation of that project. Amy?
I would just say one thing I caution about that report. I definitely know which one you're talking about, but it only covers childcare. It does not include public programs. So, you know, as we're looking at the early childhood system, I would just want to be aware of that, so we can, you know, we're including public and private and family-based and, you know, the whole gamut of, you know, early childhood environments, learning environments.
Thanks. So I know we've been hopping around. I want to take a few more minutes if there's any more feedback around this point, around kind of coordinated or increased resources for professional development, before I bring us somewhere else in our tour. Lori.
I have a couple of thoughts. The first is that I think coordinated is the most important piece of this. We as educational professionals are given lots of frameworks to work within. And so we have strengthening families, we have early MTSS, or some people do. There's also another one that, you know, is being talked about right now, which is to do with like the social emotional learning through the, I was trying to look up what it was, cultural continuous learning that the state is also involved in. And so there are all these different ways to get at the goal, right? But if you're asking people to learn a system or learn something and then implement that, but you're giving them multiple options, which are great, it's great to have multiple options, there needs to be some sort of crosswalk so that they can see where everything intersects with one another. And that's what I mean about coordinated. Like, it would really be great is just as a state educational system, we could adopt, or early childhood education system, we could just adopt one model, because it's a lot of different models to learn, right? And so people who maybe are strengthening families grantees, like, they're focusing all their professional development on that because that's part of their grant requirement, right? People who are part of these other special projects who are focusing on social emotional learning, that's where their focus is going to be. People who are part of the early MTSS project, that's where their focus is going to be. And so you have people doing similar work in a variety of settings using different frameworks. And so either be nice to have one framework. Touch points, yes, thank you, Cynthia. That's another one, which was, I think, the original one like 20 some odd years ago, but they all get to the same thing, and there are intersections. But if you want that to be digestible to the workforce, it has to be presented in a way that makes sense to them, right? If I keep going to my staff every year and say, well, this year, this is our focus, and this year it's this focus, right? Like, there's just so much for them to take in, remember, practice, even unless we have just one, like, these are all the different like philosophies, theories, models, practices into one. I think it's hard for people. I think it's why it's not always successful, because you're asking them to do multiple things, and we can't do anything well if we're constantly focusing on 3 or 4 different models.
Point taken. Thank you for your thoughts. I see a couple other hands. Amy, and then
I definitely
Linda.
hear you, Lori. And there is, you know, we call it initiative fatigue, you know, where people are asked to do so many things. But I guess I wanted to clarify. So when we're looking at early MTSS, that's a framework, but, things like strengthening families, that is a curriculum that can be absorbed within, or the continuous learning that, we're a part of, that is also something that can be absorbed. That is highly, just intensely steeped. That continuous culture of learning is steeped and anchored in pyramid model. So within early MTSS, we have, that's an implementation science framework. So whatever initiative we want to decide, or whatever a program wants to decide to push forward, that's the framework that they're kind of using. And they're using it, it calls for evidence-based practices, and it calls for those components of the system to kind of be looked at. So within that is the social and emotional pyramid model. It's kind of a framework within a framework, but when you're looking at those practices, again, that's kind of a, that's just a foundation to hit. And that does, and there are crosswalks out there, how that also merges with strengthening families and other things. So I guess I think it can be really confusing sometimes on how this is supposed to work. And again, it's that PDG grant that we're trying to push out. I think that will help kind of clarify as people become part of that. But I think it's important not to lose focus of that these curriculums fit in, but the framework is filled with something that calls for measurement. That, how are we going to measure high quality? Because I didn't see anything about measurement in there. So it's just that's PD is just one component of that. And it does, I don't know. I just, I that's all I'm going to say right now.
Okay, we gotcha. Thank you.
Okay.
Linda, and then I'm going to move us to another part of these, Rex.
Thanks. And I have to go after this. I have to cook lunch.
Okay.
I just want to say, I think the PD is really important and it is needed. But for me, when we think about inclusion practices that reduce expulsion, we need to really look at the system that is supporting that care and really look at how Part B is being delivered, because time and time and again, it's failing children and in programs. And so I know that's really a big controversial thing I just said, and I have to go, but I think PD is great, but we also have to look at that system, that Part B system that is supporting, that's supposed to be supporting children who are, most at risk for being expelled. And I also, when I think about inclusion, I had a really hard time finding resources and professional development around diversity, anti-bias, anti-racist, all of that stuff. And when I reached out to Northern Lights, they're like, yeah, there's not a lot in Vermont. So when I see inclusion, my mind is going there right now, and I would love to see the state trying to do more in that area.
Thank you, Linda. The good news is that I believe,
yeah.
Okay, yeah, I believe that there's funding in the current preschool development grant that's going to Northern Lights in part to support that. So hopefully that will help.
Thank you.
What's for lunch, Linda?
I'm grilling burgers. So.
Great. Good luck. Thank you. Okay. Thank you for this feedback. I had no doubt that this group would have a lot to say about this placeholder. So you gave me a lot of fodder. May I move us to another part of the recommendations on our tour? Let's hop in the boat. I'm going to move us up here to UPK. So I feel like there's at least 3 conversations we need to have. So I'm just going to track our time a little bit. So the pre-K language the heading that's in bold, Seize the Day on UPK, is a carryover from 2022. The sub bullets, some of them have changed. And so I'm going to read those sub bullets and then we'll love some feedback. So revise the regulatory framework for quality and equity, including agency roles and ability to provide leadership, support, and oversight, defining and monitoring quality standards for governance, facilities, licensing, and regulations, and revising the strategic plan with a shared vision toward integration with the larger early childhood system. That's a mouthful. Seek resolution in the appropriate number of hours and weeks per year for UPK education and appropriate weighting of students. And the third is extend the tuition agreements that currently allows Essex County children residing in the Northeast Kingdom's school district to attend their family's choice of schools in either New Hampshire or Vermont to Act 166 and UPK and the UPK program. Given the rurality of the region, many of these children attend kindergarten out of state, and extending this opportunity to UPK will increase equitable access in the region and enable children to access early childhood special education services. So that's something that has come up year after year in the legislature, and they've not cracked that nut. So I want to pause there if there's questions or feedback about this recommendation.
I wanted to, did we put 3 and 4 year olds because of 76? Because UPK is 3, 4, and 5 year olds not yet enrolled. And I didn't know if we were kind of thinking about 76 in that.
I don't know. Let me clarify.
Okay. Yeah, just the law says 3, 4, 5. That's why I was thinking, if we want to kind of stick to that verbiage.
Oh,
yeah.
Like making that part of the recommendation.
Right. Yeah, because I wouldn't want 5-year-olds cut out anything if they're eligible.
Yeah, I'm going to add a note. Okay.
And then I guess that first bullet, I guess I wanted to know maybe a little bit more information about what the thinking behind revising the regulatory framework. So I just wanted more information.
It's a good question. I'm gonna see if there's someone in this group who feels like that's needed, and if you want to respond to why. I don't have in my near memory this was language that came out pre-systems analysis and pre-Act 76. So perhaps the language needs to be a little bit clearer.
I wonder, Beth, was this around the idea or the recommendation perhaps that universal pre-K for all 4-year-olds and that be run solely or overseen solely by the Agency of Education and not the Child Development Division? I wonder if that's where this bullet and some of that language might have come from.
Yeah, around the governance issues. Yeah.
Or was it part of it needs to be a separate organization for, a elevated, taken out of AOE, taken out of CDD and elevated into its own? That was the study before RAND, right? Sorry, yep. Studies get jumbled.
Yeah, I just will add, I think it is around the governance issue, but I'm like you, Beth, I'm not very specifically clear on what it was suggesting.
So regardless, if those of us in the room are not feel like this language is compelling, I think that's enough for us to need to rework it and be much clearer. So point taken. Thank you. Other feedback?
I think bullet 2 seems really important. I think they're 10 hours that has long, what was a starting point for universal pre-K. And I think there's not necessarily always agreement on how UPK should be delivered, but I think there is agreement on looking at the number of hours possibly being increased.
Okay, that's what I was going to ask. Are we kind of asking for action to take place to increase those hours within, I suppose, private programs?
I mean, if if we were to revise Act 166, for example, and increase go from 10 hours to 15 or whatever, I think that's right. Instead, what happened with Act 76 aside, right? If we were to just update the original statute and add hours in there and adjust ADM, I think that's the kind of thread that it was running on. I see some hands, Cynthia and then Claire.
Yeah, I'm just mulling over, Beth, since you said that this was drafted before the most recent legislative session, I'm also curious how the UPK study is going to impact, and would we be getting ahead of that study too much, or are we trying to impact or influence that study in any way? And I think if we are trying to influence the study, then I think having really targeted recommendations like the number of weeks or hours per year, like the weighting, for instance, of per pupil, those kind of recommendations resonate for me. And I guess I'm struggling with what's our role in that. And if we spend a lot of time and energy here, and it is actually the UPK study that's going to sort of take hold, what's our influence over that, or our role in that, versus do we spend our energies on other recommendations? And again, just questions I have related to the timing of this as a recommendation package.
Yeah, it's concurrent, right? The UPK study won't come out with their recommendations probably until, I don't remember what the timing is, but after these will be released. Claire.
I think that I'm just circling back to what Sherry was saying and adding somewhere in our notes, looking at parity between private and public systems. That's a big issue. And I don't think that flies in conflict with what Cynthia was just saying. I mean, we know that I would definitely recommend that we note as a recommendation that there is an examining of parity when looking at the weighting and the hours.
Yes. Thank you. Okay, so some very concrete feedback. I really appreciate that. Folks ready for me to move to Act 76?
Can I ask a question? So if we, on the third bullet, and I understand, yeah, there's definitely children. So what we're saying is allowing those children, if there's not choice, that they can go over state lines to receive some kind of preschool, right? That's what this is.
Right, so right now,
Yes.
families living right on the line who have might have a third grader going to school
right
across the bridge, but their 4-year-old has to travel 25 miles to get to a pre-K.
And that's something that we've talked about within the AOE early education team, because we do want every 3, 4, and 5-year-old to be able to have access, to some kind of education and universal pre-K system. My only question is, and this is something that we've been trying to figure out how to get over this barrier, just within our team personally. There are assurances that universal pre-K programs sign, and they are equitable. They encompass the Vermont Early Learning Standards, things like that. So how could we enforce that in New Hampshire is the question that we always come up with. Can agreements be signed that would assure them to, so then those children are receiving the same high quality, equitable education that their peers are in Vermont. That's, the only question I have.
Right. I'm sure there's probably multiple things that would need to be evaluated to, for accountability reasons, but New Hampshire has their own standards. So if there's some kind of recognition of what those programs are needing to meet to be able to function in New Hampshire. Right now, there's a lot of kids who are not accessing anything because their families can't get them there, or there's not spots. So I think it's a very interesting equity discussion. You bring up some interesting pieces from the kind of accountability side, and families are really, really struggling, and kids are not in any programs because of it. So, yeah, Beth.
Yeah, I think it's sort of, Amy, that's not what I want to comment, but Amy, to your point, I mean, sometimes we have kids that are on the border that we in licensing, we create these sort of, not fake accounts, but we have to open up their center-based program, right, in order to pay them through CCFAP because they're able to get that funding. So, and we sort of in childcare license, we sort of feel like, well, if New Hampshire gave them the license, well, that's got to be, that there's some standard there. So I don't disagree with you, unpacking that a little bit. My point of this one was that this seems is the Northeast Kingdom the only rural county in Vermont that's struggling? We have towns on both New Hampshire, Massachusetts, New York border. And so my question when I read this was, why is it just this? Why are we looking at just this area? And should the recommendation be that we look at any border town, any rural border town who may also be in the same spot? So that's all I wanted to say about that.
Thank you. And I've asked the same thing, and I would have assumed that kids were going to other programs in New York and even Massachusetts. We've not heard it from those communities. We've specifically heard it over and over again from Essex County. So I think it's something really to listen to and to think, does the language need to be broader? And I would imagine that it wouldn't, if the language was approved in statute, that it would be about kind of some reciprocity agreements or something like that.
Beth, we've definitely heard it in other parts of border communities. But yes, I agree.
Okay.
It should be just localized for sure if we were going to move forward.
Right. Fabulous. Any other comments on this section? Trying to get all these notes in the comments. Okay, I'm going to move us. Thank you all. Is the screen share still clear enough for folks? Okay. So I'm going to give you a moment to look at the Act 76 piece. Essentially, BVF is charged with monitoring the implementation of Act 76. There's also kind of a call to ensure opportunities for stakeholder engagement, as well as kind of clear communication to families, and especially those newly eligible for CCFAP, which is already starting to happen, but wanting to make sure that there's resources to continue that.
Beth, I just want to highlight, from where I sit, I feel like there's some good energy and planning around getting the field support resources. But I feel like in the circles I'm in, we keep coming back to like, where is that support outreach information for families?
So does this language resonate with you, Sherry, or do you feel like there's something that could be clear?
No, it does.
Okay.
This feels like really important.
Great. Thank you. Claire?
Yeah, I guess again, just kind of emphasizing that thinking about the CCFAP eligibility, the 2 stages of having increased eligibility criteria. I have already so many parents like asking me, I think the parents are really confused, and I think we could do we could do more work. And I wonder about, I know that as the community childcare support agency, we administer CCFAP for our county. And we're working with CDD around increases in capacity to be able to manage the influx of applications. And I wonder about a recommendation that having the community agencies play a role in supporting outreach to parents and like partnering with CDD around educating consumers basically on what they have available to them and really doing a push and promotion so families can actually access. So it's around access and partnering.
Okay, did I get it here?
Yeah, I guess, I don't know, the word I'm looking for also is flexibility, and CDD might be like, no, there's no flexibility in those CCFAP positions, but I think it would behoove us to be creative and have more of that family outreach and connection as built in as like, yes, this works for both levels, for the community and the state.
Thank you. Because right now those positions are to be hired internally at CDD, is that correct?
No, there's both. Yes, it's a yes and a yes. There
Okay.
are increases slated based upon formulas that Emily has used to forecast what the increases will be based upon current caseloads. So there's increases in the state and as well as community. But, you know, the job descriptions are fairly narrow, and we always do as a parent-child center, do more with families. And I love the idea around doing more of an expectation around outreach and being resource and being resources to parents and educating them and helping promote their access of this additional eligibility support.
Great. So Claire, that comes like, because all of that is in development now, I don't want to lose that thought because it feels like now might be a time to influence, so let's make sure we stay connected. And if there's feedback that we can help elevate to CDD now, I'm just saying that out loud because I don't want to lose that thought between now and when these are finalized.
Yeah, it might be a nice
yeah.
thing to talk about at the state council as well. I mean, it behooves
Yeah,
it behooves us all, right? That
Right.
parents can maximize this benefit. Programs get these kids, they can shore up programs, kids can get good services.
Yeah, absolutely. Thank you. Amy.
And that was something to just kind of build off of that, Claire. That was something that our team is always concerned about, the implementation of 76. We don't want the 3-year-olds, especially those who have disabilities, to get lost in this. So, I don't know if there's room that we could add something about children with disabilities as well, because, 76, it's based on what I know that implementation of 76 kind of meeting group, they're going to be talking about the 3-year-olds, but right now there's nothing to state that how they would fit into the picture. I suppose we just want to make sure that that children with disabilities are still in the thought process as well. So I don't know if we can include that somehow in this.
Right, not necessarily specific to outreach, but you're talking about in terms of ensuring services to 3-year-olds. Yes. Okay.
Yeah, just as part of inclusion, as the implementation of 76. If we're trying to help prioritize that successful implementation, and prioritizing the focus of the 3-year-olds and those with disabilities as well.
Okay, thanks. Sherry.
I just want to go back to Claire's comments and just mention that the Early Learning Initiative project in Burlington, the First Step Scholarship Program, has something we can learn from in terms of like outreach to families that aren't connected to the system. Because I do agree, like, that energy around getting to families is really important. I understand we're still like figuring out what that looks like, so maybe it'll be all taken care of, but there is a model that's been pretty successful in Burlington, and working with their childcare support agency and going and being where families are and connecting with other partners that connect with families less connected. So there's definitely lessons we can learn from what they've done there.
Thank you.
Another way that we're going to be able to slightly do that with the state personnel development grant, just as a little side note for us, that is going to be part of that includes CIS and early intervention. And so the coaches that are going to be working with those individuals are going to be talking about how, trying to embed, again, mental health, and trying to determine how families can be pulled in more, and then how we can determine how, what they might need, who they might need to be connected with.
Thank you. I'm also reading Lori's note about language. Is that are you seeing that, Lori, in the Act 76 piece? I just want to make sure that I'm
that's where I was seeing it, and I almost didn't put it in there because I know it's semantics, but as somebody who's on the advancing the profession task force, I feel an obligation to just sort of
no, please do. Right, so like quality of childcare, changing
so like
that
it would be the early childhood education system, the early childhood, and I totally get it. It's so lengthy and long. But everywhere it says early education or early educator, if we could say early childhood, that consistent messaging and language, I think, is important for the long-term progression of what we're trying to accomplish.
Yeah.
Thank you.
Let me just make sure your comments in here. Great, thank you. I love hearing this conversation. I know there's some folks we haven't heard from, and so want to create some space if there's something that you want to share, observations. Okay, well, that invitation stands. I want to move on to the screening and services for children with autism. Again, somewhat of a placeholder based on our conversations, Does this resonate? Is there something missing based on your experience? Essentially, what we heard last month was, and we have heard from many of you that children get screened, or sometimes they even struggle to get screened, but then getting a full autism assessment is really, really hard, nearly impossible in the state, and sometimes takes years. And meanwhile, you know, child and a family is struggling to support their needs. Amy?
I guess, and I am all for this, absolutely, but I think we also have to be mindful if parents are doing it to have a qualification for eligibility of a disability through, you know, either early intervention, or really it's more for IDEA Part B. They would need to have that completed by a doctor or a psychiatrist, not, so there are stipulations per IDEA that, you know, around that. So we want to make sure that we're not doing them a disservice by not, you know, by allowing maybe just a psychologist to be able to make that assessment, because they wouldn't be able to take that assessment then to the school district and say, hey, my child has a documented disability. Because under IDEA, if a child has a documented disability, they don't necessarily have to go through, like, have that determination through an assessment through the LEA. Does that make sense? So,
yeah. Right. Not increasing assessments by just anyone, but that they meet that need. Yes. Beth? And then Chris.
Yeah, thank you. I was just thinking about this improved access and wondering how we get the psychiatric folks who are actually doing the assessment to the table to talk about what they need to expand capacity, because you know, I think at UVM in September, they're going to start referring, you know, they're going to start taking referrals, but they've been closed for over a year now for new referrals. And so I wonder how we partner for accessibility, because I think that is one of the challenges. And I think, Keith, I don't want to speak for, I don't know if Keith is still here. I saw him earlier, but just CIS services not needing, like, you don't need a diagnosis of autism to get supports birth to 3. And so I want to put that out there, and just maybe, you know, I don't know if that's about parent education, if that's again to the bullet point above in the other section is like that outreach and communication to families about what's needed for early intervention services. But post that, Vermont, I think, is still in a crisis where we just don't have people to do the assessments as these kids are getting older, which is a frustration, certainly for families.
Yeah, I don't want to jump the queue, but just responding directly, my name mentioned, thanks, Beth. Yeah, so Part C, IDEA Part C, early intervention eligibility would not be based on a diagnosis. It's about eligibility on a developmental delay. And so if a delay is present, regardless of whether that family has a diagnosis in hand, they can get services. And that is true for things outside of CIS as well, especially in that early childhood space. The diagnosis isn't always critical for necessarily accessing a resource. And I do think that's important in balancing the practical need for a diagnosis for certain things, the family's desire to have the diagnosis for a long list of reasons, but then a perceived barrier versus a real barrier. And that gets a complicated piece. And I'm just throwing a shout out to our folks at VDH, the Family and Child Health, especially children with special health needs. They do work closely with partners in the field to expand capacity here.
Thanks, Keith. Chris?
I'm just wondering if somewhere in here, we should have the language regardless of setting, so that the people delivering services understand it's not prioritized by any hierarchy of where the services are being given or where the child attends. I sometimes that gets lost.
Thank you, Chris. And Cynthia, I'm just adding your comment. So these sub bullets are really just my notes capturing the discussion, and then we will figure out how to rewrite and what can be incorporated. Claire.
Yeah, just piggybacking on what Beth and Keith just said, just kind of adding, last month I missed the meeting because that was the week of the floods and Washington County got hammered. So my apologies. I read the notes. It was pretty dense on this subject. There's a lot now happening. There wasn't for a period of time, and the backlog of wait list is really extensive. So it is absolutely true that children are eligible and can be served through early intervention CIS without an assessment and diagnosis, but that's exactly the lever that's needed to have more intensive dose services put in place. And children are missing out big time status quo right now. So I'm just noting that we're far from having a solution in place, but there are definite steps in movement, I would say, in the last 4 months that are helping us as a state be more responsive to the wait list. So kids are just ticking clocks of services. CIS isn't the answer to provide the intensivity of what children need that have neurodivergent or spectrum-based needs. And I do understand what Amy was saying. Of course, it has to be an assessment. We struggle with that all the time when children transition. At 3, having an assessment or a diagnosis that the school will accept, and there are some private places that are offering that service that schools are not accepting right now. So I guess I'm echoing and then clarifying that in my mind, this is still an absolute need to have advocacy around. There are steps in place. There's trainings established. There's partnerships that need to really be nurtured with local pediatricians and MDs to a great extent. More resources need to be brought to this system. So thanks.
Thank you. And Jen, I see your note in the chat. I appreciate that. Rose.
I just had to find my mute. The one thing that I actually am just thinking about is we're talking about access to the screenings, making sure that we communicate with doctors, hospitals to be able to get the screenings even scheduled. But Jenny actually last month had brought up just the being able to be creative about getting families to, once we find somebody to do these assessments and screenings, being creative about connecting the families to them, because transportation can be an issue. There's other barriers that are in place. So it was just something I was thinking about and that Jenny had mentioned last month.
Yeah, and completing the paperwork, transportation,
Yes.
It can be really far.
Yep. And a lot of families don't have access to the transportation or, the CIS staff, are they going to be driving, how are they going to get people to these locations? A lot of them, in Bennington County would travel over to Dartmouth. So that's quite a travel, so.
Thank you.
Yeah.
I love the idea of providing resources because physicians can make the call. They're just hesitant. A lot of times we hear from families that their physician is just hesitant to do so because they don't feel like they have enough information themselves, not necessarily about the child, but just in general about how to go about diagnosing that, assessing that. So that's a great idea.
Claire, go ahead.
Yeah, I mean, echoing that, in our region, we've had conversations with one of the lead pediatricians in our larger practice, and that's exactly what she said, that their professional preparation around doing diagnoses, and it's not in their wheelhouse with a lot of confidence. And so she wanted to get connected with part of the training that I think Brina Holmes was putting together, and Adam. So pediatricians that we've spoken to also feel like they have a training need.
Oh, interesting. Okay, yes, which is
I mean, I didn't know that that was new information for me. It was assumed that they would be self-perceived experts, and that was not the case. And an NP and one of the MDs was like, no, we would absolutely need more training to feel confident in doing this.
Thank you. Okay. We've done a lot of work, some fabulous feedback. I really appreciate this discussion. I'm just going to scroll quickly to see if I missed anything. I'm going to pull down the screen share. So, thank you. I will take all these suggestions back to the team, and we will do some more work. And we'll share another version in the coming weeks. We probably won't have, these will kind of keep moving before this group meets again. So feedback really will need to come by email. So the version that you have in your email, you can look at, but don't share. And clearly, as given we just had a discussion, it's now, obsolete. So look for another version in a couple weeks. Yeah, great discussion. Thanks, Beth, for being here. All right, I think we're ready to move on with our agenda.
Okay. So I think I'm next, and I'm going to screen share. And okay. So I just wanted to give a little update about what was H217 and now called Act 76. And then I think Dawn is going to have another update after me from the Child Development Division and where things are at. But so one of the things I wanted to make sure people are aware of is, and many of you probably did get this in your email, but Let's Grow Kids does have this a site with a lot of information about the bill. The bill is really big. There's lots in it. It's staggered implementation. So there is a lot of confusion and misunderstanding and myths. And so there's one-pagers for how it affects families, businesses, early childhood educators. So it's for right now, it's, Let's Grow Kids has a really great communications team, and I'm just hoping people know that it's aware or can refer it to people. I'm positive the Child Development Division is working on communications as well. That will come out, and as time goes on and as implementation is moving forward. But in the meantime, this is a resource that I wanted to make sure that you and families you work with and early childhood educators, there might be things here you want to print out or get to families, is here and available. So that's the first thing I wanted to make sure. And then I just wanted to just talk a little bit about what we're hearing from the field, and tell you sort of some of the things that are going on right now. Let's Grow Kids, BBF, First Children's Finance, Vermont AYC are in touch regularly to sort of kind of assess what's rolling out, what we're hearing, making sure that as we're looking at the supports that might be needed in the early stages and later stages of implementation are coordinated, not duplicated. So we're sort of on that piece. A lot of what we're hearing right now is just some confusion around tuition setting, how that you know, impacts their programs, how that impacts their families, who currently may not be qualified for CCFAP. First Children's Finance is doing, I would say, the bulk of this work. If you haven't visited their site, and maybe Jen can put the link in again, they've created 5-minute videos that kind of walk people through some of these changes to their programs that I think are great. So, and the other thing I just would say, if you're working with programs or you run a program or you have questions around those types of things, First Children's Finance is a great first contact. And they're, like I said, they're working with BBF and Let's Grow Kids and Vermont AYC and other, we're all staying looped in with CDD, but allowing them space to get their work done because it's an enormous lift. So we just want to make sure that people have the resources they need. So tuition setting is confusing, how it impacts families. There is some concern, particularly on family childcare homes around, we're hearing a lot about, will they still be, if they are eligible currently for Dr. Dinosaur for their family, will this set them on a benefits cliff? That's some of the early, like, trying to figure that out, confusion. We're trying to, like, be a resource so that we can better understand that impact, and if it's a reality, how much of a reality, how widespread, those types of things. Those are some early concerns that have just come in the last week or so. And think those are the things I just wanted to share, that resource, so that in the meantime, when people have questions, if there's early childhood educators that have questions, First Children's Finance is a great first step. We're all working together, and I think that's it. The other thing I just will share is I am on the UPK study committee. We've only met once. We don't have a meeting schedule, but I would be interested to see if there's opportunities to use the ELD committee as a feedback loop, as you know, I don't really have a full scope of what that committee, how that committee is going to be run and how that's going to go forward, but certainly any opportunity, it's a great group we have here, so any opportunity that I am able to use these meetings to get some feedback from all of you and updates, I'm hoping to do that. So I don't know if anyone has any questions for me, and then Dawn will
just on that piece, Sherry, I can't remember if it was at this meeting or another meeting that we learned that those meetings are public. And so perhaps helping to distribute, you know, just announce and when they're happening and what the link is for people who want to follow along.
Awesome. We'll let John give the updates from the Child Development Division.
Oh, there are updates. So the plane is nearly built for the readiness payments. Janet and I were on the Teams into the evening yesterday, and so here's my updates. Act 76, as you all know, the first rate increases are done. Hurrah for our CDDIS team for moving on that so quickly. So then the readiness payments, that's sort of the next big rollout. We anticipate, we can just about ensure that the applications are going to appear on August 18th. Most folks are going to start hearing about their first awards around September 1st. That's our initial plan. The way that the money is going to be not distributed, but calculated is that we have a formula. We have a base rate per setting, per child, and then there are going to be percentage bumps for various categories. Some of those are going to be self-attestation bumps. Some of those are going to be verified through BFIS and CDDIS. There are lots of bumps, most of them being 10%, some are 20%. Some are up to 30%. For instance, the amount of CCFAP students that you are serving, depending on the percentage, the bump could be as high as 30%. That's on the base rate, not the cumulative So you don't get 10% and then 10% and then 10%. So we anticipate those happening, those payments going out monthly for 6 months. At 6 months, what we're going to do is look at the pot of money left and extend the payments or increase payments. We want to make sure that every dollar of that 20 million is out the door by June 30th. So while people are going to get sort of a predictable monthly payment for 6 months, most likely, depending on numbers, we're going to see an increase for those final 3 months of payments. The way we created the formula is that we used that survey that ended on July 28th to get feedback from providers. And there were several categories that were added. For instance, like offered food or, oh my goodness, there's so many categories. There's like 10 categories, but I'll just say offered food is one of them that we added as a bump. We also looked at the legislative priorities as written in Act 76 and made sure that those were represented across. We did take things like specialized childcare as a bump. I believe it's at 20%, because that was another thing in the survey that people said, we want a little more recognition for specialized childcare, and we agreed. So anticipate, well, I've got to work on the application today. That is my rest of the day, is finishing the application so it can go into a job form and we can test it over the next couple of weeks. We anticipate that if you get your application in by the 15th, you should have your payment around the end of the month. The business office and financial folks are really hustling to get this done. There was one other thing that I've just lost in my big. The other things I can give you update on that's going to be coming to you, we're going to be bringing the enrollment versus attendance discussion in terms of the larger discussion to ELD in the near future. We just had a meeting about that before I hopped on this meeting. We also will be sharing the preprint of the CCDF plan, which is in comment. For OCC has it in comment time, so I want to make sure you get the link for that to be able to read and give commentary. We are certainly reading it. And actually enrollment versus attendance is in there. And then the PDG positions, we are about to unleash a lot of positions that were approved through JFC, both the Act 76 positions and the PDG positions. So we're doing those in batches. So 2 big batches so that we don't completely flood the applicant pool with so many positions. So we're very hopeful that we are going to get some great folks. The 2 positions that we just, well, one we just finished, and then we have one in interview. We're excited about the applicant pool. So we hope to attract some more folks. If you've got folks who are looking for a job, we're a great team. And then finally, I know Lori mentioned the continuous collaborative learning initiative. That's an initiative coming through Child Trends and the University of Massachusetts. So while we're sort of hosting it through us, it's not really our project. And yes, they are using a very loose model of the pyramid model, but they're not asking programs to learn a framework or a curriculum. It's much more based in going to a program, having them help design a goal in terms of social emotional learning, and then coaching them through the process. So it is social emotional learning, but it's a little bit of a different model. And you would be, there'll be 8 programs invited from 3, 4, and star programs. And then you would be with them for 2 years, and you would be part of a pretty amazing research project. So that's being funded through ACH and then moved through Child Trends and UMass.
And Dawn, I missed the first part. Were you saying you're recruiting coaches for that, or you're recruiting programs to participate?
We will be offering, so we're not actually recruiting anybody. We are offering the names of the 3, 4, and 5-star programs to CCL, and they are going to do the recruiting. We are going to offer names of potential coaches, and they will do the recruiting. So we are sort of the facilitators of the information and much less the recruiters of the project, which sometimes my team I'm like, it's not our project. You can't tell people what to do. They're good. I trust them. They're real researchers. So yeah, I'm excited. Vermont was one of only 3 states chosen to participate in this project. So it's a big deal that they chose us. It's us, Massachusetts, in Illinois. So some nice differing populations. And I hear the diversity, anti-bias, anti-racist training, and it is part of the PDG, and it is part of the contract or the grant for Northern Lights. So I hope to see some more robust offerings in that category very soon. So I'm going to stop and let's see. Yes, I'm going to stop. And if you have questions, I'm going to do my best to answer them.
I have a question, Dawn.
Okay, I'm like, I didn't give you all of your information.
I know.
Yes.
So this is about the reimbursement applications, because I'm receiving a lot of questions about programs that are maybe opening in September and not in August. So I'm wondering if there is how long the application is open for.
The application will be open until the 6 months is done. The way Janet and I spoke about this actually last night, and programs can apply as soon as they are open. And then they will receive payments from the date that they are open forward. If a program applies late, so let's say in October, we will backdate their eligibility to September. So we don't want folks to miss out just because they applied a bit later. What will happen is their reward will be calculated, and then as the same formula, and then their first payment will most likely be a bigger chunk, and then you will get the monthly payments. So yeah, we're really trying to make sure that everyone is as well supported as we can. You know, if a program opens in October, it will start in October. And this will be based on licensed capacity, not enrollment. We're trying to be really thoughtful about how we define this program.
I think that will be appreciated for sure.
Yes. I've actually had some of those questions, and I'm like, as soon as you're open, please get in contact.
I'll just note that I appreciate that, Dawn, because we haven't been able to run close to license capacity since COVID. Thank you.
Well, and one of our goals is, of course, to help folks maybe move to their license capacity, because they'll be getting additional resources to be able to do that. Actually, that's one of the questions. Do you intend to increase your enrollment, to your capacity? And you get a bump for that.
Yeah, if we can hire, I think a lot of us in the field. That's great.
Yeah.
Thank you.
Yeah. It's always nice to be a person giving away money.
I know, so fun. Any other questions for Dawn? Thank you, Dawn. It's very exciting to know we're a short time away from getting those applications open, and yeah, and you guys, amazing work. We do have some questions. And I have an in-person meeting I need to travel to, so I'm gonna sign off in a few minutes and turn it over to Beth for the rest of the facilitation.
Thanks, Sherry. Go ahead, Clara, and then Chris.
Just a quick question, Dawn, around communication to the field. Will something be going out to everybody with a little summary around this?
Yes. Janet and I are working on sort of multiple streams of communication. that are going to happen very close together. So there will be a program overview that is available that will be, then the application is going to be embedded in that, but there will be a number of communications moving out quickly. They are all about 2/3 of the way completed.
Thanks, Don. Chris?
I'm just wondering if there's going to be a requirement. For example, you need to have a UEI number. I know that's federal funds usually, but if that's a requirement, maybe getting that out to programs earlier than the application would be beneficial because of the time frame it takes to get that type
Yes.
of number back.
We will not require a UEI because this is not federal funds. These are state funds. So we have, and this is not a grant, this is a beneficiary payment. So because we were able to swap, or not swap, but because we were able to use different definitions and different pools of money, Chris, we will not need a UEI. That's what, with grants, you did because it was federal money. So hurrah! We did ask. We did ask that because of the kerfuffle with the workforce bonus and retentions. I mean, that was one of the reasons it was so long to get that money, was because it was federal dollars.
Thanks. Amy?
I just had a quick question for the culture. I can't even say it. The Culture of Continuous Learning project. How many programs will be chosen for that?
8.
Okay.
Yeah.
Thanks.
And it will
Amazing
be
updates.
Sorry, it will be only childcare. They unfortunately don't have a model for family childcare at this point, but it will be childcare centers and Head Start as an opportunity. So they've limited it.
Okay, thank you. Any other updates or announcements while we are together? And then I have a note about membership. Okay. I do want to mention BBF is sponsoring, is organizing a family voice advocacy training. And that is free. We're encouraging family leaders to attend so that they feel even more confident in sharing their stories and making an impact. So if you know of folks who might be interested in that, I'm saying that I don't have a link on the ready, but I will get it out. So that's something that's coming up. Most of our regional councils do not meet until September, but they have been updating the regional action plans and will be reconvening in September. We have a new regional manager, Kelly Hayes, who's serving Central Vermont and Memorial County. And then we do not have an August State Advisory Council meeting, but we have one in September and October. So those are just a few BBF updates. The last thing I wanted to mention is that the leadership team for Early Learning and Development Committee, which includes Sherry and Dawn as public and private co-chairs, and support from me from BBF, we are looking at kind of representation at the Early Learning and Development Committee. I would say we've done a great job. You know, if you look at who's on the screen, I feel like, you know, the representation across those who are serving kids and families or managing the system is pretty decent, and we could do better. And so we'd love to know if you're interested in continuing with the committee for another year, or if you are ready to tag out. In particular, we're wanting to make sure we have, like Chris, it's great to have a family childcare provider represented. Lori and Linda hopped off, but you know, in terms of having childcare, center-based programs represented, some of you have been sitting at the table for a while, so we recognize it's a tough time. If you're an agency member, sorry, you can't tag out. We want you to stay. Anyway, let us know if you are willing to continue in your role or if you're looking for us to try and find an alternate. And then we are going to kind of do an assessment of who we feel like is missing. Like Claire, having you from a parent-child center and CIS is definitely a gap that we felt. So it's great to have you here, among others. I think an email is going to come from Sherry or Jen, and then you just need to respond to say to let us know your status. Thanks, Chris. I'm responding to her note. Okay. Jen, was there anything else on the agenda missing? No. Great. Have a great rest of your day and great weekend. We will see you next month.